Thanks so much for joining for this webinar. Now, we'll just give a quick introduction about our keynote speaker, Sumit.
Hi, can you guys hear me?
Can you hear me now?
Yeah, we can hear you now, Ravi.
Perfect. So, Farah and team, are you there?
Yes, we all there.
Perfect. Good morning, everyone. So I should say good morning, good afternoon, and good evening because I can see some clients joining from different parts of the world. I can see some clients joining from South Africa, Saudi Arabia, and Kenya as well. So welcome everyone for this webinar. Thanks for spending out some time and joining this call. So as a start, I would like to welcome Sumit, who is Managing Director of Savi Group. So I'll just give a quick intro about the Savi Group. So let me introduce Savi Group. As I said, so Savi Group is an healthcare revenue cycle analytics and medical records management company based out of US, and they have been serving 40 plus physicians group with 1,000 plus medical practitioners, around 11 specialties on 3 major billing platforms. So it has been, it was founded in 2004. They have various software and tech ventures like Savi Sense, which is mainly deals with business intelligence platforms, and they have Savi PM, which majorly deals with practice management systems, and Savi Project, which is majorly a workflow management system. This is the Savi services clients across various specialties, including labs, hospitals, mobile health, home health, nephrology, cardiac surgery, internal medicine, IDTF, and behavioral spaces. So they have been serving across United States of America, catering to several Fortune 500 and Fortune 100 clients as well. Now, coming to Sumit. Sumit is the managing director of Savi Group, and let me give a brief about Sumit. He's a second generation entrepreneur where his parents moved from Punjab to US in early or late 70s, I believe, and then they have started their own business in US. So Sumit, born and brought up in US, and he started his entrepreneur journey at the age of 13, where there are quite interesting facts which Sumit can share it with us in terms of his journey. However, some interesting fact which I would like to share, which is more enticing, is that he's a music composer. So he's a DJ, worked for Hollywood, and he worked for good. I mean, he's a very good music lover. If you can see, his tattoo says that his tattoo is also around music. Is it true, Sumit? That is true, right? I saw in your pic.
Correct, yeah. I have a lot of music-based tattoos.
Perfect. Yeah, Sumit, just on your words, we would like to hear something from you saying about you and your entrepreneurial journey.
Sure. A little bit about me. Like Ravi said, I started my first business at age 13. I've been in healthcare for now about 6 years with Savi Group. Savi Group was started by my mother in 2004. And when I came on, it was a good time of transition where a lot of providers were focusing more and more on data. So my background is more data related and data intensive to focus on financial outcomes and clinical outcomes. So looking for diamonds in the rough, looking for ways to improve collections and just kind of improve what the providers do and get paid for their services accordingly, rather than providing service without compensation. Savi Sense has been around now for almost 3 years. We've been speakers with SciSense, which is Gartner's #1 rated BI platform. We've been speakers with HBMA, and really just continuing the journey to focus on the patient. Everything I do is really geared toward the patient, and just continuing that journey together. And I think we're going to discuss some of that a little bit later today with our back and forth. Thank you guys for having me.
Perfect. Thanks so much, Sumit. Pleasure is ours to invite you here. So I'll quickly start with small video that's done by a big research group, that is KPMG. Then we can jump into our core topics by covering the key takeaways that we discussed earlier. So let me
Healthcare organizations are leaving millions to billions of dollars on the table due to patient loss.
Health systems are losing patients to competition because they don't understand how to build a relationship over time with them. Drive loyalty, drive stickiness, if you will. I think our healthcare system clients are beginning to understand the competitive threats that face them. It's no longer just the doctor down the street. It's a lot of other entrants in the healthcare system that can provide the same services that they provided, and sometimes cheaper and more efficiently with a better experience.
I think organizations are struggling to figure out how to meet new consumer demands and how to apply digital health or virtual health to their organizations. So we're seeing consumer demands increase because of what they're experiencing in other industries. If I want to deposit a check, I can just take a picture of it and it'll be deposited in my bank account. Consumers want that same accessibility and ease in healthcare. They want to be able to be seen by a primary care provider based on their convenience. So if I have a condition and I wake up in the morning, I don't want to wait 14 days to see a provider. If I can be seen virtually the same day, that's even better.
And our systems have to be able to meet that in the middle, if you will, and react to that in terms of the services they're offering. There's great opportunities for our clients that maybe they don't see right off the bat because they're so focused on a legacy operating model, and our job is to help shift their view, if you will, to the opportunities for the future. Digital transformation in the healthcare industry is all about removing friction. Friction in the patient experience, friction in how clinicians do their job every day, and friction in how the health system operates to serve both clinician and patient.
With healthcare organizations, we're helping them understand where are the opportunities to streamline and centralize patient access capabilities so that they can basically put a plug into any patient leakage or revenue they may be experiencing.
Perfect. So this is the context that we want to put across, and we are going to stick our topic towards this, how we can engage patients during this technology enabled services. So during these conditions, there's a big demand in the existing market where most of the patients expect their services to be delivered at home and expect their services to be more personalized. So putting this across, Sumit, we can cover a couple of points where I'll just want to put the key takeaways that we can focus today's our discussion is around this. So these are the broad points we are targeted to cover on this summit. So first, on how this patient engagement strategies can improve patients' interactions with their healthcare systems. So wanted to hear a few words about this, Sumit.
So I think really what the video was stating is we're more in a now need. It's no longer scheduling for the future and scheduling for 2 weeks away. We want to be treated. We want to be taken care of now. And I think, especially in U.S. healthcare, we're gearing more and more towards that, especially with COVID, because with COVID, Trump announced some I guess leeway in the telemedicine area and the RPM area, and now that's here to stay. So being able to speak to your physician via Zoom, via GoToMeeting, and the physician getting compensated for that type of service, being able to be remotely monitored and getting data constantly. You see all these companies also gearing their technology, Apple with the iWatch, Fitbit, Samsung, I think it's called the Gear Watch, if I remember correctly. Sorry, I'm an Apple guy, not an Android guy. But all of these different products, you could get your health at your fingertips. Now you're getting, Apple just announced where they do the blood O2. So I think using these technologies and really driving that engagement with the patient. You can communicate electronically. In the US, I have Kaiser as my insurance, and Kaiser has a portal where I can text back and forth with my doctor rather than having to call him or her and try and catch them in a break or try and catch them between patients. I can send an email and I'll get a response within 24 hours or less. On specialists or doctors, you could do an e-visit directly within their platform. I think that it really makes it easier as a patient to engage my doctor. as opposed to kind of, well, the doctor's not available today, so hopefully the symptoms will go away in a day or two.
Absolutely. Absolutely. Perfect. So, coming to Sumit, like when we are doing all these things, so now data has become very crucial, where we have to deal with different types of data in terms of patients, because now as most of the systems currently in the market are where data is getting stored in a centralized thing. Most of the hospitals these days are operating in a disparate systems where like every branch of the hospitals have their own systems and they are operating in silos. Now the trend is shifting towards the centralized data, where the corporate office can track all the operations that are happening in these hospitals from one central location, so that there is a more demand to shift the focus towards data as a platform types, in extracting the insights from the patient data, more importantly towards the patient data, because patient is the customer for them, and they want to ensure that the customer's data is to be stored in a very secure place, and is to be like make available in the way that they want, because they want to retain the customers to their hospital at every point of time. So considering these aspects, as you're already dealing with these analytics, your group is already working on different analytic platforms, like Savi Sense. So how do you take this as a opportunity? Like, what are the opportunities that you can foresee in these kind of elements as a as a DAAP, that is data as a platform, and how this analytics is going to drive the management of these hospitals?
So, firstly, I wouldn't really say patients or the customers, because that I would say we're getting into a fine line. But I would say that as the patients need improvement, as the patients, like you said, there's disparate systems. There's different EHRs, from hospital to the general practitioner to the different specialists to anything with physical therapy or with behavioral. They're all using different EHRs. So as we're going further and further, I think we're going to go towards more of a standardized file format, which isn't there today. But as we get to that, we'll be able to do much more care consolidation and care coordination. So if we can get these different systems to talk to each other, we can coordinate patients' care and improve patients' care, and also avoid negative issues. Like in the US, there was an epidemic for painkillers. A lot of patients were going to get drugs from different providers, and it was tough to keep up because the providers, again, their systems don't talk to each other. So that caused some issues in the past. And I think transitioning towards that standardized format will help us better understand the whole life cycle of the patient, the whole life cycle of any case or any issue or any diagnosis, and help us to better treat the patient. And then getting to the analytics, we can use that information and use that data, because there's just an enormous amount of data points that we get, as that providers get, that healthcare businesses such as myself on the financial end get, that aren't really used. So using a BI platform or building something in order to analyze why was patient A treated a certain way versus patient B treated a certain way? What were the outcomes? Were patient B's outcomes better, and why? And being able to work that together, you can now improve the clinical outcomes in the long run. And you can also, if you're a business, you can improve your financial outcomes, because if patient A and patient B got the same service, but were billed for different services, now you're finding out your gaps. Now you're finding out those little diamonds in the rough to improve your financial standpoint without having to do much more effort, because you're looking at it. At the end of the day, kind of taking that black box and breaking it open and making it as transparent as possible is really the goal with data as a platform.
Absolutely. Perfect. So when we are discussing about this patient life cycle on the patient care, so in this entire journey, Sumit, see, the another important thing is that when we're talking about the patient journeys, so it is a platform like using BI tools, different BI tools like Tableau and other things. We can easily track and the management or the respective departments can track those analytics and they can track how the patient journey is going on. So is it the same importance we should give the patients as well to access such information? So how crucial you feel that it is important that patients also should get the entire journey in their hospital using a single and seamless experience solution? It can be mobile or it can be some other platforms where they can track the entire their journey with the hospital.
I think yes. I think it has an extreme level of value. I think that it should not be as detailed as what the provider is looking at, because there's also the notion of too much information can put fear into a patient, and then if you put fear and anxiety into a patient, you can create issues or create new clinical issues that weren't there previously from the behavioral standpoint. So it's making sure you're giving the right information. Today, I don't think that's occurring. I think there needs to be more research on what reactions are to patients, and based on the information they get, and what do patients understand. For example, if you go get a lab test, do you understand all the genes that are written there and what the numbers are? And if you're given just the numbers, or you're given access to that data without a description of why, or without understanding what these are, you're going to run into issues. So I do think the provider's role is still very important in communication and understanding. So I think going towards the data is a good idea, but still having that provider in the middle. Provider should describe the data before the patient kind of gets it in their portal or gets it in their app, however they're able to look at it, because they're at least given a brief on understanding on what it is.
Absolutely, got it. So I understand, Sumit, like every country has their own kind of security things. Like for example, US has its own personal information sharing kind of policies and procedures are there. At the same time, when we are talking about this right information, sharing the right information, as you said, so I understand that you are already a HIPAA compliant professional where you understand all these healthcare related security compliances. So what is the base information that is safe to share or safe to capture any patient's information and show it to them? I'm keeping aside this clinical thing aside because that's altogether different subject. But in terms of any mobility solution or any kind of access point that we are going to give it for any patient. So what information is safe that it is safe? I mean, we can we can display it on the mobile or any kind of access points that we provide for the patient.
So to be honest, I'd say everything should be going towards single sign-on, where you have to either get an OTP or you have to have a login in order to see any piece of information, even outside of your first name or your first initial last name. Your full name shouldn't even be listed there. I think that it's extremely important for the security and safety of the patient's information. You really shouldn't be sharing anything, to be honest with you. You should have everything within a login. And that's how all the health systems here do it for security purposes. They have to log in in order to see any information. Clinical, of course, always password protected, always within a password. But even demographics information, every detail to me should be secure. And that is more HIPAA compliance, is to continue to do that. HIPAA and ISO compliance are to focus on making sure not any data point is breached.
Perfect, got it. So now coming to this new trends that is coming over, because now we are dealing with good amount of patients data, and we're also dealing with the security of data, these elements. So now, how is this AI is going to play a big role in this kind of data management? Like when artificial intelligence come into the healthcare, so what are the things that they have to focus more while dealing with the patient's data in a typical hospital environment?
So, me personally, I don't believe in AI from the financial outcome standpoint. I believe that it's more machine learning today. I think AI is more right now in like artificial limbs and and clinical side. On the financial outcomes, on patient data, it's more machine learning because we still have to teach a system what to do and how to look for information. That's just my personal opinion.
Absolutely. Perfect. So, can you just educate us on these financial transparencies and the financial outcomes and how Savi is helping these hospitals in giving this financial transparency to their end customers?
So I think that most of the time there's waste. Anyone who's Six Sigma certified will understand where I'm going with this. But realistically, there's waste in any business. There's waste in any industry, and it's understanding your waste. In healthcare, there's a lot of waste, from patient statements never being sent, from insurances never being billed, from the doctor charting a service that they may not know is reimbursable. So there's all these little gaps, and what that creates is waste. What that creates is loss. And to use the data to understand where these gaps are, like I can name a couple of products that I've worked with in the past that some of the EHRs are getting to do structured data. So every word can become a data point now. And utilizing that and understanding where a provider is charting a certain description of a service that's actually payable. That's using the analytics. We want to make sure to capture everything, because that is an issue, to be honest. A lot of hospitals, a lot of providers aren't billing correctly, in the sense of either underbilling, which is an issue of loss, but also overbilling, where they're going to have to give refunds, or they're going to be sued, or something can happen. You want to make sure that everything is done above board, and you want to make sure that you're capturing every service that's reimbursable, capturing it correctly, capturing every diagnosis. Because if a patient, and this also goes to clinical, but if a patient's presenting with multiple diagnoses, but you only wrote down the primary diagnosis, not the secondary or tertiary, that changes how the patient has been treated. That changes the data and understanding what was really going on with that patient. And you want to be able to capture all that information, analyze all that information, and hopefully use machine learning in the middle there to get that data and use that data for the best clinical outcome and the best financial outcome.
Absolutely. Got perfect, Sumit. So, Sumit, now if you see the latest trend that's happening because of this COVID is about telehealth. Like most of the patients wants to experience that one through online, and I think most of the companies have been getting acclimatized to that kind of culture, including the home visit doctors. So, how do you foresee this as a like in terms of financial transactions, in terms of this patients come doctor experiences? So, what do you foresee about the transparency in the financial transactions, or the kind of business model that is going to work out towards this telehealth concept?
Well, I'd say telehealth is here to stay.
Okay.
And it's good. I think it's great for patients. I think it's great for providers. Providers are able to sit in the comfort of their home. Patients are able to sit in the comfort of their home because if you think about it, and think about like you personally with your family, your children, your siblings, your parents, a lot of times something simple can be treated over the phone if you have another person in the home. If it's a cold, give the person tea, or give the person vitamin C. There's simple things to do that will stop overloading the ERs, overloading the urgent cares. So while COVID is terrible, this pandemic has kind of ruined economies worldwide. This is one little benefit from it, that telehealth was forced upon everyone. And that forced adoption is going to continue because people have seen how it works. People have finally, providers more so than patients. I think patients have wanted it for a long time, but providers now were forced to add that line of business, to add that service. So it's a good way to supplement, their patients in the office because they have to be there for a full day in an office. And if they have patients scheduled just in the morning and afternoon, they have nothing, let's say 11 a.m. to 2 p.m., what do they do for those 3 hours typically? And now they can fill that with a telehealth visit. So they're now able to utilize their time better and be compensated for their full time rather than having forced breaks during the day because either they couldn't schedule a patient in the office or a patient canceled. So I think it's here to stay in a good way. I think financially we'll see, especially in the US, what happens. Fee schedules are usually released in November in the US, but I think they're going to kind of make it similar to the regular E&M codes, the in-office visit codes. And there'll be a slight dip, I think, but not a big enough dip that it'll scare providers away from continuing to provide the service.
Perfect. So, Sumit, in the same lines, like when we are talking about the entire telehealth, where we're expecting the doctors to come online and patients to collaborate, doctors and patients collaborate online. In the same way, there is much need for the pharmacy as well to give a takeaway kind of prescription, takeaway kind of medicine delivery, or making the prescription to be accessible to the pharmacy of that hospital or any generic hospital. So how do you foresee, like, is it going to be like most of the countries don't allow the medicines to be delivered at home without any prescriptions from the doctors? So now the business models are going to tweak a little change in most of these hospitals where they have to deliver the medicine at patients' houses, kind of thing. So considering this aspect, so how do you think that this pharmacy management is going to be in future and in the near future?
Well, to be honest, I'll say I'm a little biased. In the US, it's very easy to get takeaway, very easy to get a delivery to your home. You do need the prescription from the doctor, of course, but if you're willing to wait a couple of days, or you're willing to wait, I think on Kaiser it's a week. Some insurances it's 2 days. Some insurances you can pay extra to get same day delivery, but the delivery is already here. I think pharmacy's been there in terms of catering services to the home for a long time in the US. There's always been delivery. There's been delivery for at least, and for me, since I've ever needed medicines in the lot that I've done it myself rather than my family. But for the last 5-10 years, it's always been, hey, I can get it delivered. So I'm hoping other countries will continue to follow that, and it's safe, it's secure. As long as you can confirm the patient's needs, I think the pharmacies do a good job about scanning. Like, just to give you an example for how I do it, if I order a prescription, my doctor puts in the prescription with the pharmacy, I put in the order. But when the delivery person comes, they need to scan my ID. Once they scan my ID, then only will they give me my prescription. So I think they've done a good job of making sure that everything is scanned, so they have proof that they're giving the prescription to the right person, because that's important. And God forbid if this ever happened, but my brother's name's Amit, my name's Sumit, so if I went to the wrong Mahendru, they're able to catch that and make sure they don't give the wrong prescription to the wrong person. Thankfully, that's never happened, but they have those safeguards, which is good, and as it should be.
Absolutely, because that's how, as you mentioned, that instead of name, it has to be like ID based kind of thing. So being now most of the hospitals are they're managing their own HIS systems, hospital information systems, so they track all these medical records properly in terms of IDs, everything, and this kind of prescription should not be a major problem for them to deliver, as long as the government supports. Because in US, yes, it is being allowed, but in most of the countries, it's not still allowed without any prescription like that. Perfect. So, Sumit, I think the last point that we would like to discuss, then we'll jump on to question answer sessions from the audience. which we want to discuss is that now, if you see, there are major transformation happening in the healthcare industry in terms of access points, in terms of their transformations and implementing several intelligence and analytics kind of platforms in place. So there is a need, like most of the hospitals management has to redefine the role of the senior management, especially the kind of CIOs or CTO kind of roles. So they are going to get a good challenges and good kind of, in the existing industry to cater to the new demands. So what do you foresee about a typical change that these kind of CIOs and CTOs should forecast or should take care of post this situation in the healthcare, or especially in the kind of hospitals, I can say, what kind of roles that may create, or what kind of roles that they foresee a good kind of change in their job description and roles and responsibilities?
I think that harps on kind of everything we're talking about. They should be focusing and become agile to learn digital technologies. Focus on adding business intelligence as a process rather than saying, hey, we have intelligence, we have an analytics company, but learn the various steps of a process of business intelligence and digitize as much as possible. Hospitals have such high costs because they have such high infrastructure. They have all this physical pieces that go along with it: staff in the hospital, location of the hospital, all the rooms that they have to have. And yes, I think that holds a high value, especially still with COVID, because we need the beds, we need to be able to take care of patients with the vents. But from a management perspective, becoming more agile, becoming a lot of managers, and this is what I've seen in my experience, in my career, is a lot of people, once they get to that level, are very rigid. They're not as comfortable to change. And being open to that change and understanding that COVID has brought the future to now. We thought we could push out telehealth. We thought we could push out remote patient monitoring. We thought we could push out a lot of these digital services and this transparency to patients. A lot of hospitals, a lot of providers thought it could be pushed out. They could kind of continue to do things the old way. And you saw this 10, 15 years ago with EMRs coming into play, where providers were forced to go from having big filing rooms with all those folders that had like 50, 100, 200 pages to having to do everything digitally. That adoption was not successful immediately because providers fought back and balked at it and said, no, I don't want to do this. And it took where something, I think, and I wasn't as involved in the healthcare industry back then, but I'm guessing that they thought it would take a couple of years to fully adopt EMRs. It took like 15 years. There's still providers I see today who are charting on paper. So as leaders, as management level, we need to transform. We need to digitize. We need to utilize technology more and more and more. I think that's what the future is trying to find these new pieces of technology that fit in to make a patient's life cycle easier. And it's the experience. The patient experience of sitting in a waiting room for an hour before even talking to a nurse sucks. But that's what the experience has been over 10, 15 years. If all that level can be digitized and the patient can just come in, wait 5 minutes, and be let in and see the provider, that experience now has transformed. That experience is improved. The patient is now happy. And they found, from a clinical standpoint, if a patient's happier, if a patient's more comfortable, the outcome improves. So that's really what they need to focus on, in my opinion.
So true, Sumit. I completely agree with you on it. So I quickly wait for the questions from the audience. So we are open to receive any questions from anyone here. Please, you can unmute and you can ask questions to Sumit.
Please, looking forward to it.
Sumit, I believe that we did switch on the videos. Is it okay that we can switch on the videos so that I think
Sure.
can see? Yeah. Sorry, I think I missed that.
Oh, of course, not a problem. I think I just turned mine on. You guys should see me now.
Perfect.
anyone has any questions, please unmute and ask away. We're looking forward to answering anything you may be interested in learning.
So here I'll get a question. Like, what would you do to people who are staying in rural area and who are not actually getting the proper treatments or proper visits? How would this technology is going to help people over there?
So I think that's what telehealth is gearing towards. Telehealth first started in the U.S. for patients who didn't have access to care. So specialists were able to check in on patients remotely via video and send like a local nurse from the local hospital to touch and feel with the patients. But I think that technology is helpful in that regard. I think there's a lot of products, like if the big electronics conference in the US is CES or HIMSS for healthcare technology. And a couple of things I saw last year were products that were like these little boxes that had a video camera, that it was a machine that had a thermometer and it could do the little checks of the patient. Anything outside a surgical procedure or anything where it requires an injection. Those two things I think unfortunately cannot be done digitally and remotely yet, but they're getting closer and closer. I think over time, that's what telehealth will cater towards more than anywhere else, is people who don't have the access to care, locations that don't have access to care.
Perfect.
Okay, thank you.
So just before someone jumps with their question, I just thought of asking one more thing in terms of when you're mentioning about the devices and the other things. So I'm sure that most of the hospitals are now, is the time for them to introduce many touchless technologies. Like,
Yes.
so how do you see that the touchless technologies is going to be a good? What kind of disruption that is going to happen in hospitals, especially on the touchless technologies? Like which area that the hospitals can imbibe these touchless technologies into their day of life?
I think the main area is intake more than anything else. I saw it actually recently. I had a doctor's visit a couple of weeks ago, and when I walked in, now they have it set up so there's a temperature taking about 5 feet away. You stand in a location, it takes your temperature. If you're clean, you put a sticker on yourself stating that you've been checked to walk in. And then rather than talking to a person and checking in and paying for your visit and knowing which area of the hospital to go to, it was all just right there on a little kiosk. I swiped my insurance card. I'm sorry, not swiped. I actually just held it to the screen and it took a picture to let me in. Told me my copay, swiped my credit card, and I walked right in. It told me where my doctor was. It dramatically sped up the process, and I don't know if that's just because of COVID, because maybe less patients are being seen, so there was less of a waiting room. But I walked into the hospital. I walked to the room where my visit was, to the waiting area, and within about 2 to 5 minutes, I was seeing my physician. So it was very, very quick, and I thought that's great. That's disrupted so much of time, and it's helped the patient dramatically. Like before, it would be an hour before I saw my provider.
Awesome. Perfect. You do understand, because there are many other areas as well, like as you rightly said, it's an intake kind of thing where there is a lot of touchless is introduced. So in terms of payments as well, like if you see, most of them are like adjusted to the kind of missions. So now they can use all this a mini infrared kind of payment acceptances in the devices that will allow them to do all the touchless technologies. Whenever, I mean, I'm talking about the on the count, I mean, over the counter kind of payments.
Yeah, they're going towards a lot of apps. Personally, I use an app called Papaya where I can take a picture of my bill or take a picture of the screen, and it'll send the payment to the right person. I personally love it. Coming from the generation that grew up with cell phones, grew up with computers, I hate pulling out my wallet for any reason. I like to do as much as I can on my phone or on my watch by using Apple Pay or or PayPal or Venmo. And even doctor's offices are getting to that. I've seen doctor's offices that when you go in, they say, okay, here's my pay. They have like a card in the front saying, here's the PayPal ID. Put your patient ID in the payment, and that way we can make sure your payment matches, because they don't want your name in the payment area. So they'll say, put your patient ID there, and you're good, and you can pay for your services. It's made it a lot easier for the patient, and it's made it a lot quicker for the provider to get paid, because before sending a statement, I don't know about you, but if I see a healthcare statement, all my statements I usually put in a stack, and I'll check once a week or once every other week, and you tend to miss things constantly. And I miss, if it's a healthcare bill or like a parking ticket or something, then I would miss it. And rather than taking payment right away, it took like 15, 30, 45 days for that person to accept the payment because I forgot as a patient.
We have a question from Archana. She says, how IoT and technology will work in healthcare in future?
I'm sorry, can you repeat that? It cut out a bit.
How IoT and technology will work in healthcare in future?
That's interesting. I think it's going to be constantly changing and evolving. Technology, healthcare is, in terms of, from the financial standpoint, healthcare is a little bit behind the ball. I think a lot of people are getting better and better. I think companies such as Synergy Maxim, companies such as Savi, companies such as providers who are looking at the treatment for patients, like the artificial limbs or the robotic arms. So I think technology is catching up, but it's going to be an interesting 5 years. I think it's going to be a huge jump. 5 years from today, if we sit here and have the same conversation, it's going to be so dramatically different because the improvements made in the technology in healthcare. It's going to be a massive jump. It's going to be fun to watch.
Awesome. So in related to this, Sumit, I would like to take this look. Now, there are many areas in the healthcare, like one on the access point, like patient access point. Second is on the IoT side. Third is on the touchless side, on the financial side. Then on the medical equipment side. So there are many elements if you think about typical ecosystem of this healthcare. So where do you foresee that the next major investments crop in which technologies that in this healthcare where we can expect more investments coming up? Which areas of this you feel that major investors might show interest?
Wearables and remote monitoring. The amount of data that comes from a wearable is huge, and the amount of things you can find out from a patient. You can find out patient success. If you've told the patient to exercise 20 minutes a day, how do you track that as a provider today? You don't. You're reliant on the patient telling you. So where the wearable comes in, it's tracking a lot more information. It's tracking patient success. It's tracking patient engagement. It's tracking patient compliance. So I think that's where the investments will go. And I think we've seen that also over the last 18 months, 2 years, the shift and the growth in the wearable device area to healthcare. 2-3 years ago, you couldn't do an echocardiogram. 2-3 years ago, you couldn't do O2 levels or sleep monitoring. All these pieces, I think, is where the investments are going to go. It's going towards the technology to watch the patient, to make the patient comply, to make the patient improve. So I personally believe wearables, and you're going to see a huge influx of wearables for remote monitoring, because it's like patches. You can wear a patch where it can track a lot of your data and a lot of your information and success. And that's really, investors really need lifelong patience. We want our patients, we want people to live as long as possible. And that's really the best way to continue to track patient information and patient compliance. You're going to improve their outcome, and you're going to make patients live longer. I think the life expectancy should continue to go up and up and up because of that.
I agree with you.
We have got one more question here. So the question states like, how will a mobile app applications like technology like this is going to increase patient experience and efficiency as it lacks a personal touch? Because basically now people all are like very emotionally binded with doctors. We like the doctors
Yeah.
who are emotionally in touch with us. But while we are going to do everything on the mobile or the technology, how will the personal touch or emotional touch would be there?
I think that's kind of what we touched on a little earlier, where the provider still needs to be part of that patient ecosystem. The app is great. The app does a lot for you, but you still need to see the provider at points. I think it may reduce provider contact, but you still need to see the provider in person. I think no matter how far technology gets, we still need that human interaction. I just think that what technology is doing, it's helping the provider to streamline a little bit better, to understand what's going on with the patient before the patient comes in, and to help that conversation. And that'll help them with their waiting rooms. That'll help them understand, because diagnosing takes a long time. And I think that's why patients are stuck in waiting rooms, because providers are spending so much time with each patient to understand what's going on. The technology is just a piece of it. The technology is not a replacement, I think. The technology is kind of just a new tool in the tool belt for the provider.
Perfect. Sumit, just one more question. The question says like this, like COVID has really disrupted healthcare a lot, and digital disruption is very evident. With this huge shift, what new roles you foresee within healthcare ecosystem?
Creating, that's unique. I think we're going to see more of a shift to nurses getting better treatment, nurses being higher in terms of value rather than the MD as much. I think that the need for healthcare workers it's shown how dramatically understaffed healthcare is, because you see these issues country to country where hospitals are running out of beds, hospitals couldn't care. I think that is what COVID brought up, is that we need more people working in healthcare. We saw it. I mean, in the US, there were hospitals that were overrun, that we didn't have beds in certain hospitals where patients couldn't even come in because COVID was so overrun. I know that happened just reading the news and watching the news. That happened in so many countries around the world that we found out we weren't prepared. So I think that you'll see more people needed, and I think you'll see better disaster planning. That we found a scenario that no one could have ever planned for. No one ever thought would happen. So now you're going to see people in the planning team, strategic hires, as well as just more people in general. I think it's going to go more to that over the next couple of years to prepare. While, knock on wood, we hope something like this never happens again, but we have to be prepared for it.
Awesome. Can't agree more. That's absolutely true. So that's how the future roles going to be. Perfect, Sumit. Sumit, just in line to this, I got one more question, more specifically for your Savi Group. So now that there is a value-based treatment is going to pick up, so what is the future of value-based billing going forward? This is the question I received from a guy from Deloitte.
From Deloitte. Value-based billing is here to stay. They're changing E&M towards more value-based. A lot of the code sets are being changed, because it's been, in the past, a lot of codes have been time-based. So providers were incentivized to spend more time with the patient rather than treat the patient and treat the outcome. There's going to be more incentives for providers, I think, for having the right data. So if I can prove, and I'll just give an example for a transitional care company we work with. For transitional care, we're just transitioning the patient with a comorbidity out of the hospital into the home quicker. So we're reducing the hospital bed days and letting the patient be treated in the home for comfort, for improved outcome. And what that has done, a lot of hospitals are tracking ER readmits. So if a patient presents we send the patient home. Within 30 to 60 days to 90 days, they're tracking, has the patient come into the ER during that time frame?
Okay.
And if you can reduce that ER admit, a lot of readmit rates are like 15 to 20 to 25%. These are for the sickest of the sick, not just for an everyday person who's going in with a cold. But if you can show that you can make that readmit to 10%, someone's going to incentivize you. That's value-based. You're providing value for the patient. You're providing value for the hospital by removing that bed, by freeing up that bed, not removing that bed. Freeing up that bed, freeing up that room, freeing up the nurse, freeing up the provider. So down the line, you've freed up more time to take care of more patients. So it's gonna be that. It's the outcomes.
Absolutely. Okay, so Vishwanath is there, right? Vishwanath, you have some question. So you want to put that question here, or shall I read it out? Vishwanath. Okay, so I'll just read out his question. What he's saying is that any thoughts about sharing real-time wait time with the patients? People usually spend more time waiting in spite of appointments. So he's
I think it's great.
yeah.
I think it's amazing to be able to do that, because I think some urgent cares do that today, but I don't think it's globally used. But if I know it's going to take 15 minutes to be seen by the provider, I'm more inclined to go get treated. Rather than if I see it's going to take 2 hours, I might say, okay, well, maybe I'll go later because I don't want to sit in the urgent care. Or alternatively, if I can, similar to like making a reservation in advance, if I can if it says it's a 2-hour wait time, I can put my name down, and then it tells me, hey, it's 30 minutes till you're seen. Please make your way to the urgent care. Please make your way to the hospital, or please make your way to the provider's office. I think that would be amazing. Personally, as a patient, it saves a lot of headache, a lot of stress by just sitting in a waiting room.
Mm-hmm. Absolutely.
Well, one more questions come our way. That is like technology is obviously brilliant, and now we see technology is actually reducing a lot of labor cost, a lot of labor and manpower solutions. So, is it going to happen? The technology, the more empowerment the technology is getting, the more power of labor loses or human resources loses for that matter. Because if the patient, the applications and stuffs are taking a lot of less time to make any administration things or something, so there is a lot of people going to lose their job. Isn't that because the technology is going higher?
I think in most industries that's true, in a lot of industries, but I think in healthcare you need people. You can't treat a patient just with the technology. The technology will not replace the humans. It's just going to make the humans better. It's going to make us more efficient, because we'll be able to focus a little more rather than spending time trying to figure out what's going on. I personally don't think that the tech will replace human jobs too much. Maybe on the data side, maybe on the analytics side, but not on the treatment side.
Okay. Got it. Surely, because I think last time, Sumit, you rightly said, like, healthcare is a recession-free industry. So where your mother also accepts for that. So your mother also substantiated the fact, which we strongly believe in, Sumit. I think that's how we also build our business model around healthcare and education in the same lines. So having said that, it was, that is an inevitable fact that we will have to accept. And so in terms of losing jobs, in substantiating to what the question earlier it is asked, yes, there is a that, as Sumit said, it happens in every industry. But as long as we cope up with the latest trends and the latest happenings that is going around the industry, so that should not be the major problem for any individual to cope up with.
Yeah, I couldn't agree more. I think it, like we were saying, it's recession proof.
Exactly.
There's always a need for people. And I just think being agile, if you're a business, if you're in healthcare, be agile. Be ready to make those changes. Be comfortable making change. If you're uncomfortable making change, yeah, you'll be replaced. But if you're comfortable making change, you'll succeed.
Absolutely, Sumit. So I think thanks so much, Sumit. Your insights and your inputs are definitely very useful for all of us, and you have addressed a lot of questions on I mean point to point, and thanks for your patience and thanks for your time, Sumit. It's glad that we have you on this discussion. Thanks so much for joining this call and giving your valuable inputs.
Thank you for having me. I really appreciate it. There were some great questions, and I think this is a great conversation. Let's continue to focus on technology and digital transformation.
Absolutely, Sumit. So true. We are all be in touch, and we're happy and glad to speak to you soon on the next sessions, wherever it feels available for you. I mean, based on your availability and based on your feasibility.
Sounds good. Thank you guys for having me. Have a wonderful day, night, morning, whatever time of day anyone is, and whatever time one is in.
Perfectly, Sumit. Thanks so much for joining. Have a
Yes,
Thank you guys.
as it is rightly said by Arthur, any sufficiently advanced technology is indistinguishable from magic. So let's make magic work.
So
Thanks
true.
so much for your time. Thanks, Ravi, for your time. Thanks, everybody, for joining us. We will surely share the recordings with you in next 24 hours.
Surely, Farah. Thanks so much. Thanks, Sumit. Thanks, Farah.